Hello all, this is Dr. Dheeraj Masapu. I would like to tell you something which happened in my life years ago. I attended a conference and I was sitting in the audience. I was just listening to multiple speakers. I usually don't listen or focus on any of the talk for more than 2 to 3 minutes because my attention span is slightly lesser. That the reason might be I usually don't find any talk very interesting in the conferences which I attend. But one day what happened is I saw one speaker who came onto the stage and he started the talk. Maybe I don't remember the topic, but I think it is subarachnoid hemorrhage. The whole 15-minute talk I focused. The reason I focused for 15 minutes is because I could feel the passion in the presenter. Even though my attention span is less, I could focus for the whole talk. At the end of the talk, I went to the speaker and told him that this is the first talk in my life where I could actually listen. Listening in the sense, I just imbibed all the 15 minutes, whatever he has told. And he is Dr. Saurabh. And he is head of the Neuroanesthesia unit in one of the major hospitals in Gurgaon area. I wanted to do a video on neuroanesthesia as a career. And I thought he would be the best guy to talk about that because, more than heading a unit, he has passion towards the subject that I rarely find in people nowadays, which is there in him. So I thought I should interview him. Like, why did he choose neuroanesthesia? And did he start liking neuro from his MBBS days? So how his day in his life will be, so that you'll understand how I asked him very tricky questions like, should everyone go for a DM? And also, there is a lot of supply now and demand is decreasing, I feel. So how is the supply demand stats in India? And how should we overcome such kind of a high supply of doctors? Every question he answered superbly, and the interview follows now.
So choosing anesthesia was quite a simple thing for me. I know what I can't do. So I thought that I can't do surgery. So all surgical branches were out at that very moment. And the rank I got, I was getting Jaipur surgery. So at that time when I have taken the surgery and anesthesia, I have kept Jaipur surgery below Jaipur anesthesia. Oh. So the people who were there actually asked me the same question. So you just go outside, think for 5 minutes and then come back. But my response was same, that I wanted to do anesthesia. And the reason for that is that at that time there was no DM in that. So I thought that I will do practice just after finishing my MD anesthesia, and I want to stay in my native place. That's Jaipur, but that both of the things didn't happen. So it's actually changed after that. So that's the reason why I choose anesthesia.
So basically, sir thought it's an end specialty, and second thing, he wanted to stay with the family. Both didn't happen.
Yeah, somehow both didn't happen. And why did I choose neuroanesthesia and neurointensive care? That's also a strange story. I was in AIMS doing my SRship in neuroanesthesia, and I left AIMS after doing for 1.5 years actually. 1 year and 8 months or 9 months, something like that. And then I just left it thinking that I am going to do everything in anesthesia now. But somehow the strange, I will say, the irony, or I don't know, but right now I can't say that it's an irony. But yes, destiny was destined, I will say. And I will get more of the opportunities in neuroanesthesia and neurointensive care, and from that point of time I have started taking neurointensive care, especially as a super specialty in my life.
Got it. So it is more like your journey is the journey has selected you more than you.
Yes,
decided.
you can say that.
Yeah, got it. So it's a different kind of.
But one thing I just wanted to add: after doing anesthesia for 1 year. My specialty gave me one more reason. In fact, my state gave me one more time to choose the specialty. I have a recounseling after 1 year. There was a Supreme Court case going on, and then I can actually go ahead and take medicine, which was my preferred choice at one point of time in my native place. I was getting that as well. But after doing anesthesia for 1 year, I thought that this is the specialty I want to be in, because I am doing the what the medicine people are doing, I am doing that too, and I am doing that on table. Okay. It's like a decision which I have to take quickly, and that's just an adrenaline rush which is there with anesthesia. I was actually liking it at that time.
Perfect. Even I actually relate to that. It's more like we see the effect immediately after giving the drug.
Yes.
So in medicine, in other medical branches, when you give an antibiotic, you have to wait for at least a period of 3 days or 4 days to see the effect. But in anesthesia, it's not like that. The moment you inject a drug, you see the effect.
So I choose the neuro case in my MBBS final exams also, in the prelims and in the final exams also. Always, that was my preference, because my thought process was nobody is going to take that case. Let's prepare that one. I'm going to pass easily.
So you're smarter than
So that's my interest.
That is his smartness actually.
Nobody is going to take a neuro case. Neuro case will be lying down, and if I just prepare it, I need not to prepare respiratory, I need not to prepare cardiac, I will just prepare neuro.
That is absolutely true. In MBBS, whoever takes the respiratory case will get the toughest part.
You are going to pass.
Yeah, you don't need to make a diagnosis.
You don't need not to make a diagnosis.
You are chief of a unit in a major corporate hospital in India. So how will your day be? Like somebody wants to reach a position, they should also be able to take the kind of day pressure, how the day goes.
So, see, I will say the most important thing which I tell all my colleagues is that the day you are not feeling like coming to the hospital, please change your hospital or change your lunch. So you should enjoy your work. See, at this level, I will say it's very difficult going to hospital and doing almost a similar kind of stuff every day without having an interest in the field. So please pick your cards carefully when you are doing all those things. Another important thing is how is my day, what Dheeraj has asked, is that routinely we just reach our hospital at 8:15. I straight away went to the OT, and we generally induce our first cases there. I generally induce 2 cases simultaneously. Third OT we generally start after I have taken my ICU rounds. So first 2 cases we just start, and then after that I went straight away to ICU rounds at 8:45 or 9 o'clock. And then we took our ICU rounds, and ICU rounds have been divided between different teams. So there is a neurosurgical team which is coming. We have divided their times as well. So neurosurgeons come first, then the stroke team will come, and then the neurology team will come at around 10:30 or so. So we have a gap of around 9:45 to 10:30 to have a breakfast for everyone, and then the neurology team will come for the rounds. So it's that we finish all rounds at around 10:30, 11. Then I go back to OT, take whatever we have started. At that time, most of the time, the first cases will just be finishing off. Yeah. We just go for an extubation, and if there is requirement, I can go before that as well. And then till the OT is being cleaned and all those things are done. So the people who are posted in ICU with me, I just go ahead and take a collaborative round of all those things which has happened for all the patients. It took us around 1.5 hours to do that as well. And then shifting back to OT, because the lunchtime might have started, then we just start having our lunches, we free everyone for lunch, and then come back to ICU if there is a procedure which is required. There are some counselings which are done. So I generally keep my counselling period at around afternoon time when I am free. So I am sitting with some of the counselling sessions in the morning as well. See if there is a 5 patients in neurosurgery and one of the patients require a counselling at that time. So I am sit that counselling and do that counselling at that point of time. And after that, there are some queries of the relatives which are related to me and related to the heads. So that I generally solve it after the lunchtime and do that. And then it's like toss over. And then in between that, there are some management decisions. There are management meetings about infection control, about the OT sterilization committee meeting, then antibiotic stewardship. There are a lot of things which are going on at that point of time. Every quarterly there is a meeting. So every month or every 15 days, I will say there is 1 or 2 meetings which are lined up with the team as well. So by that time, the evening round times came, and it's like we just got up free by 6 p.m. or something like that. And nobody is deprived of coffee, nobody is deprived of lunch, and nobody is deprived of teaching as well. Teaching is there in my department almost every day on the round which I am talking, the round which I am going to take last. It's a bedside teaching also, which is going to be there about specific cases. and the systems are in place about that. So we have a regular mortality meetings, we have regular incident findings, we have regular infection control meetings. We are taking anything which is see, if the outcome is not on the expected lines, we do have meetings about that as well. With all those things, and the legal suits are coming big way in India, so it's documentation is our priority. There is one person in my department who actually looks after in the evening that all the documentations of today's cases has been done or not, and it has been recording on the HIS system or not, and the ICU notes of all the patients have been there or not. So we usually take care of all those things. So documentation is the way to go. I think this is one lesson. Live his life and dedicate his life to education. See, MBBS means for whole of your life you need to study. That's the bottom line. You can't move forward without studying whole of your life. That's the motto. So that's if you want to have your education career in the education, go outside. India is not meant for that. India is not still ready for that.
Okay.
That's the bottom line from my end.
US and UK are good.
Yes.
Australia is also very good.
Maybe, I don't know. I haven't visited all those countries for these reasons.
Yeah.
But see, what I have seen is that still people give more importance to money than education. If you want to have a career in education, you want to study, there are more structured courses outside. There are, I will say, your kids or the kids who are watching this video, they will have more exposure to the things which they can do and which they can think that they can do apart from taking the medicine. Even if they wanted to take a medicine, they have a structured course there rather than having a different university conducting MBBS in a different way in India. Not talking about MBBS.
That's what.
Value padhai ki nahi hai. Value, it's not only about MBBS. It's about, see, if you want to do a good engineering, you want, see what people are doing here. They are going to IITs. They are studying those structured courses which have been laid foundation way back. Okay, and then they are coming out. Most of them are giving IIMs exam. Okay, or they are going to have some corporate jobs. Okay, and then they are going. How many of them are doing MTech? How many of them are going to research?
Very few.
So it's see, people are still not clear. They want a job for themselves. For job, they are offering, they wanted to do an MBBS, they might wanted to do a JEE or JEE exam, they might wanted to do a CUT, but they don't think that I wanted to do maths, I wanted to do physics, I wanted to do biology.
So passion towards subject.
So passion towards the subject. If you have a passion towards the subject, then you please go to a structured university. That's my take.
No. Then you have to tell me.
So see, if you wanted to do, I will still say that if you wanted to do something in education, see, MBBS is not a job, man. It's a passion.
Okay.
MBBS is it's not somebody's life is with you. Okay, is in your hands. You can't be casual, as Nitin has already told you. How can you be casual? So it's the whole family depends on somebody's life sometimes.
Yeah.
He might be the only sole learning member. You can't take it casually. So what I will say to them is that once you complete your anesthesia, give 1 year to different specialities at least. Don't straight away jump to super specialization.
Super.
I will say that please go ahead and do 3 months in critical care or 4 months in critical care. Go ahead and join 4 months in neuroanesthesia. You might have taken anesthesia by any of your reasons. I am not saying that you are taking it for the rank which you have got. You might have taken it for n number of reasons. But now when you are in anesthesia, you please go ahead and choose your super specialty, or might be in anesthesia, because in general anesthesia nowadays people are doing fantastic jobs. There are regional anesthesia societies which are only doing regional anesthesias. There is onco anesthesia which has been separated. So please go ahead and look into different specialities and then choose your career, because now for next 40 or 45 years you are going to do the same thing. So at least now do whatever you wanted to do passionately at least. So what I meant to say, general anesthesia is a super specialty in itself.
Yeah.
Okay, so if you want to dedicate your thing, even after you have been rotated in your MD times, go ahead and do it once more in next 1 year. At least if you wanted to take, some, for example, a neuroanesthesia, go ahead and give 6 months to it before you choose it full time for your life.
Yeah.
Go ahead and do a super specialization. I don't mince my word in doing that, and I think I have missed that in my life.
Each medical college is having 20 seats, 30 seats.
So that's where your quality and passion is going to make a difference.
So quality guys.
Yes, definitely. So you should work on yourself. So it's just like you have to sell yourself in the market. Okay. So you need to know how you are going to sell it to your employer. So Dheeraj is in Bangalore. Nitin was previously in Hyderabad. I am in Delhi NCR. So how many of us are still going to, I will say, a good tier B cities? They're still lacking those facilities, the kind of work which we are doing.
Yeah.
So I won't say that there will be dearth of employment, but definitely people should be ready to serve in those cities, and those cities have everything right now.
So I think the demand is there. There is a lot of demand.
But before you go to those cities, and just got yourself trained enough so that you can survive. So because the one mistake might sometimes be a huge mistake in your career in these branches.
Train yourself well and then venture into the.
Superb. So thank you very much, sir. Thank you very much, Nitin. And the information that you told will help a lot of guys. And hope you liked the interview. And so this is about neuroanesthesia as a career after MD anesthesia. And so I explained in my previous video also, many people actually want to connect with me. You can do that. You can follow my Instagram and put a personal message there. I will reply to each and every comment. And also I started podcasting because I felt the videos are going lengthier and lengthier, because it needs such time to deal this kind of topics. So what I did is I started a podcast in Spotify, and even those links I'll put in the description. So if you don't have time to watch my YouTube videos, you can just podcast and hear them during driving a car or something. So that's for today. Roger that. Dr. Dheeraj Masappu logging off.